topic is something related to the vectors of delusion. See, when it moved from external to internal space. Remember, we discussed this line when we were discussing the formation of delusion, that there is something that now the delusion has progressed from external space to inner space, because the conviction has been there established in the individual. Now uh, he is convinced to such a level that even though you provide an evidence for the contrary, he or she will not be agreeing to it. So this happens when there is movement of delusion from external to inner space. This is phenomenological description of the delusion, but here what is happening is conviction is being established. Howsoever you provide the information regarding the contrary to it, they will not accept. Similarly, extension. See, now we know that various areas of patient life, or various areas of his various domains of his life is being now given importance, and he makes these kind of faulty connections between the events. So suppose if I am having a delusion related to the teaching part, related to my uh, teaching that we do and kind of classes that we conduct, so my delusion will be restricted to my classroom teaching only. Suppose it extends to my clinics. Now, what will happen? I'll try to make faulty connections between the kind of events which happen in my clinic. So, this is called as extension. Means uh, there is involvement of various domain of an individual's life in their delusion, and the content of delusion becomes extended. That various domains of individual lives is being woven through. Bizarreness is important because bizarreness means how the content of the delusion is different from the culturally accepted norms. Suppose individuals come with this complaint that this is in 1930, for example. Individual comes with the complaint that a chip has been inserted in their brain. If you are a psychiatrist working in 1930, you would say, okay, this is bizarre because such kind of event can't happen. Nobody can insert a chip in someone's brain. But we know, so this was not culturally relevant in in this era. It is bizarre for 1930 1930s to have a chip inserted in someone's brain. Okay, but now we know that Elon Musk has started Neuralink, and they have started enrolling patients for testing the Neuralink chip. So suppose in 2040 a patient comes, and you are obviously going to see such kind of patients. The individual comes and says that a brain has the brain there is a chip inserted in his brain. Though this might not be true, you are able to establish a delusion, but here the bizarreness is less. It is less bizarre because now in 2040 we know that some kind of chip has been developed which might be inserted to an individual's brain, and it is there in existence, so it is culturally accepted. So bizarreness depends on how we progress in science, how the culture or the individual they go through the period of time. So some things might not be possible in previous days. For example, 1930 or 1900, these kind of development was not there. So it was not possible for the individuals of that era to think regarding any of these kind of chips that were inserted in brain or any part of the body. But now, since we have progressed as a society, we now have these kind of understanding that such kind of possibility is there and that a chip can be inserted in an individual's body. So in 1940 these kind of description will be less bizarre because now it becomes culturally accepted. So bizarreness is always related to a time frame and how the culture is evolving. Always remember this. Disorganization. Last 2 point, disorganization and pressure. Pressure we have already discussed. How the patient is preoccupied and concerned with the delusional content or belief. More preoccupied, more pressure. Less preoccupied, less pressure. Fine. Disorganization is one thing I would like to discuss. So disorganization means, suppose as we have, as I have said, so this is the chain of thought for a delusion, and these are the faulty illogical reasoning that has been placed by the individual, and this forms a complete delusion. This is one delusion. And suppose this is another delusion. So it is very organized. First one, everything is being linked to each other. Intricate details are being mentioned by the patient when you ask if such kind of delusion is there, because everything is being associated with a logical explanation as far as the patient is concerned. How so illogical it may be for us, but for the patient is it is always logical to have these kind of connections. Right? Now if we look into the second kind of delusion, it is disorganized, because the intricate details are lacking in some part. See, here no connection has been made. So it might be possible while describing such kind of delusion, the individual might describe the events, but when you ask about intricate details, they are not able to explain it to you. So such kind of delusion where such kind of details are not being mentioned, they are not able to connect the whole of the story or the theme or the content of the delusion, such kind of delusion becomes a disorganized delusion. Organized delusion or marker that means delusional work is being complete. Here it is less or not done properly. Delusion work. Okay. So with this, we have completed the vectors of the delusion also, and we have seen